I'm Dr. Kumarvel. I've been practicing cardiodiabetology for the past 30 years. Had presented many papers in diabetes, in national and international conferences. I was specialized in diabetic nephropathy and diabetic impotency. Presented papers on erectile dysfunction in diabetes at Bangkok in August 2007. I've given quite a lectures on diabetes with erectile dysfunction producing cardiovascular problem in Dubai in July 2008. Presented a paper on diabetic nephropathy at Seoul on April 2018. Gave a speech on hyperglycemia at Nepal in June 2018. And I'm a retired professor of medicine in Mahatma Gandhi Medical College. I'm running a hospital by name Vijay Narsingam. It's a 30-bedded hospital, it's a multi-specialty hospital, caring diabetic patients mainly. And I'm the vice president of D-Care Association, that is Diabetes Care Association of Chennai chapter.
How does Imeglimin fit into your regular practice with the current landscape of T2DM treatment option? Kindly share your experience.
Yeah, this is the clinical experience with Imeglimin in Japanese and Caucasian patients with type 2 diabetes to date has shown significant and durable anti-hyperglycemic activity. Generally favorable safety and tolerability, and a lack of severe hyperglycemia in multiple trials, including combinations with metformin, DPP-4 inhibitors, insulin, and other classes. And Imeglimin offers a novel approach to type 2 diabetic patients in the management by targeting mitochondrial function, which is distinct from the mechanisms of traditional anti-diabetes drugs. Its ability to enhance insulin secretion and sensitivity, inhibit hepatic gluconeogenesis, and support pancreatic beta cell function makes it a valuable addition to our treatment arsenal, particularly for patients who have not achieved optimal control with the existing drug therapies.
In what specific patient population do you see the greatest benefit of using Imeglimin?
Yeah, this direct evidence of increased GSIs in patients with type 2 diabetes was obtained from a translational medicine study where the response to hyperglycemia during a clamp procedure was substantially enhanced after 7 days of treatment with Imeglimin versus placebo. The homeostatic model assessment, that is HOMA, beta score or of beta cell function, was also increased versus placebo in a phase 3 monotherapy trial. There is a POXEL unpublished data. In addition, Imeglimin significantly reduced the pro-insulin and insulin for pro-insulin C-peptide ratio in phase 2 studies, that is trials, further suggesting an improvement in beta cell function. And Imeglimin per se is beneficial for patients who have uncontrolled hyperglycemia with multiple metabolic dysfunctions, such as those with significant insulin resistance or those at high risk for diabetic complications. It also offers a promising option for patients who experience adverse effects like gastrointestinal intolerance with other medications like metformin, and also require an additional glucose lowering agents to achieve target glycemic levels.
How does Imeglimin compare to other hypoglycemic agents in terms of safety and efficacy? Kindly share any real world case if there.
I have a patient who really is a very interesting case as such. A boy of 10-year-old consumed 10 tablets of Imeglimin, was brought here in my ICU. And of course, I was just outside that time. I was not in. My assistant called me up and said, should I start the patient on dextrose? I said, just wait, check his capillary blood glucose. It was normal. In fact, it was say about 96 or 98. And I told to wait. Again, after 1 hour repeat test also showing around 80-85. It has not caused any hyperglycemia. So the concern here is the patient has the boy has taken this medicine in the empty stomach. He has not taken any food. So my presumption is, if this medicine acts when it's a food dependent. Like if he has taken food, probably this would have acted. That's why this has not caused any hyperglycemia. In my clinical experience, incorporating Imeglimin as individual and as an add-on therapy reduce the dose of existing medication or reduce dose of insulin. Patients have shown improvements in glycemic control without experiencing significant side effects like the GI side effect issues or hypoglycemia. It has proven effective in reducing the need for other diabetic drugs and even basal insulin doses in some cases. Its dual action on insulin sensitivity and insulin secretion, along with its mitochondrial mechanisms, provides effective blood glucose control. Most important part to highlight is that this Imeglimin ensures glucose-induced insulin secretion as well as protects beta cell and preserves beta cell mass. That's what I am trying to say. It's a glucose-induced insulin secretion. That's why that Y escaped. Moreover, like metformin, Imeglimin reduces hepatic gluconeogenesis and increases the glucose uptake in muscles. Additionally, Imeglimin has shown synergistic effects when combined with other anti-diabetic drugs, making it a versatile addition to the existing type 2 diabetic treatment regimens.
In recent time, Imeglimin sustained release formulation with Indian study has been launched in India. What is your opinion on that?
Yeah, that's right. The clinical studies indicate that the Imeglimin SR, that is sustained release preparation, has a better safety profile, like lesser GI side effects with tolerability and efficacy, also compared to metformin SR. As per the Indian study with Imeglimin SR, there were 50% lesser gastrointestinal side effects than metformin SR. Whereas the efficacy is at par with both Imeglimin and metformin remains the same, but the GI side effects is 50% less. And I have used in some of my patients and has seen the benefits like better tolerability and able to reduce the dose of Imeglimin 1000 mg BD to 500 mg BD.
How does the mitochondrial targeting mechanism of Imeglimin influence its clinical use?
Of course, mitochondrial function is crucial for cellular energy production and metabolic regulation. In type 2 diabetic patients, mitochondrial dysfunction is a common underlying issue that contributes to insulin resistance and impaired glucose metabolism. By targeting and improving mitochondrial function, this drug addresses a fundamental aspect of the disease, helping to restore normal metabolic process. This unique approach not only aids in lowering blood glucose levels, but also has the potential to improve overall metabolic health and reduce complications associated with type 2 diabetes.
What are the key safety and efficacy findings from clinical evidences on Imeglimin that clinicians should be aware of?
When it comes to safety, there are two things. One is it has got a lesser GI side effects, that is lesser gastrointestinal side effects like bloating and intermittent loose stools and all. And it has got a better tolerability, unlike metformin. When it comes to efficacy, it is an ideal drug as an add-on drug to reduce the dose of existing medication of other drugs as well as insulin. Clinical studies have shown that Imeglimin has a favorable safety and efficacy profile with significant glucose lowering effects and a low incidence of adverse effects. Its ability to synergize with other anti-diabetic agents enhances its appeal for combination therapy. Additionally, imeglimin's potential to mitigate diabetic complications such as metabolic cardiomyopathy and diabetic neuroinflammation further supports its role in the management of diabetes.
Do you believe that imeglimin has the potential to change the future landscape of diabetes treatment?
Certainly, imeglimin could significantly impact the future of diabetes treatment by providing a new mechanism of action that complements existing therapies. Its benefits in improving mitochondrial function and potentially reducing the diabetic complications position it as a promising option drug for more comprehensive diabetes care. As research continues to unfold, imeglimin may become a cornerstone in the management of type 2 diabetes, particularly for patients with complex metabolic needs. Importantly, imeglimin's mechanism is distinct from existing therapies used in treatment of type 2 diabetes, like GLP-1 receptor agonists. Imeglimin amplifies insulin secretion in an exclusively glucose-dependent fashion. However, cellular pathways employed by incretins versus imeglimin are divergent. Sulfonylureas and glycinates functions to release insulin via potassium ATP closure in a glucose-dependent way that clearly differs from imeglimin. In comparison with metformin, imeglimin's effects are also quite distinct as described. Other major classes such as sodium glucose transfer to the SGLT inhibitors, peroxisome proliferative active receptor gamma, the PPR gamma agonists, and alpha glucosidase inhibitors, they mediate glucose lowering via pathways that appear not to overlap with imeglimin's action. And imeglimin's favorable safety as well as tolerability and efficacy makes it a valuable option in comprehensive treatment plans for type 2 diabetes.
Thank you so much, sir. Any other input you would like to share apart from this, or have we covered all?
Yeah, there is one area that is not covered. That is weight, obesity. Invariably, patients, especially obese patients, diabetic patients, all physicians, clinicians try to put them on metformin to reduce the weight. But again, metformin is next to coming to lifestyle modification. The choice is only metformin. But patients with reduced weight, weighing about 25 kilos, 30 kilos patient, we can't be putting on metformin. We have to put them on imeglimin as an add-on drug to other sulfonylureas, because weight reduction it's a weight neutral. Imeglimin is weight neutral, unlike metformin. It reduces weight. One. Second thing, in cases of PCOD, I think they've been all the physicians are using metformin. Now, of late, they are concentrating on imeglimin because it is giving a better results when compared to metformin.